That's on KTN on this 30th day of June 2015. It's now time for Lifestyle Now. You know, on Tuesdays, we normally look at your health. We concentrate on your health. And today, we'd like to take care of your back, which is why joining me in the studio is Dr. Margaret Stower, who is a chiropractor. Thank you for joining us.
Thank you for having me.
Yes, and maybe first of all, we can just start by first of all telling us what exactly is a chiropractor.
Chiropractors are health professionals who are trained to treat the neuromuscular disorders of the body. So things like backs, necks, shoulder problems, knee problems, anything pertaining to the back and the spinal cord, chiropractors are trained to analyze, they diagnose them, and then they treat the disorder.
All right. And I think something unique about chiropractors, you could correct me if I'm wrong, is that they rarely, or is it not at all, use medicine?
Yes, it's very unique. They don't use medicine, streamline chemotherapy at all, medication. We don't use medication. We are generally a hands-on approach people. So we may use other modalities like ice, heat, or some electrical stimulation devices that we are trained to use, but not, we do not put medicine into the body.
Medicine is not in the picture. So remember, if you're having issues with your back, we'll open up the phone lines shortly just for you to ask questions in case you have questions. And we're going to try and sort of segment and divide it and find out, do chiropractors deal with backaches only if they are brought about by lifestyle, or do you also deal with trauma in case of accidents or the back has been injured in one way or the other?
Chiropractors deal with the various causes of low back pain as well as upper back pain. It could be traumatic, it could be just lifestyle issues, more mechanical, because the spine has a way of getting loaded either from disc compression or maybe from muscular contraction. And even your weight can increase your load on your spine. So we deal with all types of conditions that are pertaining to the back.
All right, let's start with lifestyle, because I know many of us are probably, our lifestyle nowadays especially finds us sitting for very long hours, and we also have different sitting postures, different sitting chairs really that we have provided maybe by our employers or our places of work. Maybe we can start with that. How critical is our lifestyle to our backs and how our spine is aligned?
Yeah, you'll be quite aware, Michael, that most of us work for long periods of time. We spend most of the time seated. You're either driving or getting to work, then you go to work and you sit. And when you sit, you're actually slouching into your chair. You don't sit upright. I always tell people to sit straight, think tall, sit tall, and stand tall as well. Because dependingly, some people who are very tall actually stand very stooped, and that can cause problems with the upper back. In respect to the low back, where you're seated and you're slouching into your chair. So it's very important for us to be aware of our posture, whether we are at work, whether we are at home, or whether we are at play, or and even when we are sleeping, we should be quite aware that certain sleeping positions can cause a lot of strain on your back, on your spinal vertebra. Okay,
and now that you've talked about the spinal vertebra, maybe you can explain to us what this contraption ahead of us here, in front of us is.
Yeah, this is the spinal cord. This is actually a vertebra, and that makes the structure of your spine, because this is a vertebra, and each and every person has got this in their body. So it's a skeleton. What we normally know as skeleton. You have the base of the skull right here at the tip there, and then you have the vertebral column going down into the tailbone, and out of it projects the pelvic ball. So from the pelvis is when you see the legs projecting down. And most of the time, people have problems with their back and conditions with the skeletal system because of loss of curvatures in the spine. A normal curvature should be indented right at the neck, and then it comes out on the thorax, and then it goes down again, just like this skeleton shows at the low back. But what happens, because of pain and because of muscle contraction, we tend to lose our curvatures in the spine. So we are kind of very straight, or we've lost the normal curvature that
that we should have.
That you should have.
Okay. Now, if this is the norm, is this at birth? Is this how it is when we're born, or is it something that you develop as you grow?
Yeah, that is a good question, because when you're born, you have two curvatures, really. Just it's as a baby, when it's a little, you're pretty much very malleable.
Right.
But as you develop, of course, the other curves develop with it. But basically, there are three curvatures: one for the neck, one for the upper thorax, and then one for the back. And they should go in at the neck, go out at the thorax, and then in again at the low back.
Okay, so now once you've got this, and we were still talking about lifestyle, what's the correct sitting posture when you are, for example, sitting for long hours?
Yeah, when you're sitting for long hours, you need to be sitting upright. And most of the time, the muscles get quite fatigued, because not most people could sit upright for a long period of time. So what it means is either that you have not toned up your core muscles of the spine, you're not physically fit to sit upright for long periods of time, and that's why we tend to slouch. What we have some props that you can actually use for your back, and you place it right at the chair, and that actually is designed to keep you upright. It's not a means to an end.
It's almost designed to fit there.
To fit there. Yes, yes. It's not a means to the end. The most important thing is actually to tone up your core muscles of the spine, which is the abdominal muscles, and also tone up your back so that you're not completely fatigued when you sit upright.
Okay.
Yeah.
Okay, because I guess over time you learn to sit in a certain way and it becomes comfortable. Would sitting upright become perfect possibly over time? With practice?
With practice over time, and we always advise you to get out of your chair for a few minutes, do something different, and come back to sitting. I know lots of executives sit for long periods of time. They could be there in meetings from the time they get into the office to the time they go home. But it's always good to get out of the chair, do something different, and come back. And always make sure that you're sitting tall, or you're standing tall, and you're thinking tall.
Okay, let's talk about the chairs that we use.
Yes.
If by any chance we have a chance to choose the chair, what sort of chair should one choose, especially if you sit long hours? Because I think our lifestyle, like I keep saying, is revolving towards sitting in front of a computer. You're in a boardroom, you're almost seated almost permanently.
Right, right.
So what chairs would be ideal to use?
Yeah, most of the time people should have actually a chair that is supportive. I don't want to go out there and say, okay, you need an orthopedic chair, because that has been overrated. But what you need is a chair that can actually support your back and make sure that you're actually having some support at the low back. But as I said, it's eventually boils down to your posture. Do not slouch into your chair. Make sure you sit back into the chair and your back is upright. That's right. Yeah, so a good chair that supports you right up to the spine.
All right. If one begins maybe to develop back problems, mainly because of our sitting posture, is there a way of identifying that? Apart from pain?
Apart from pain. The most time, the basic indicator is pain. You'll come into the office and say, I have this low back pain. I don't know what it is. And maybe you've just traveled for long periods of time. You've been sitting in your chair. It's just basically pain. That's what will tell you that, yeah, something's going on.
Isn't pain too late? Isn't that an indication that already it's gone way too far?
That's an indication it's already gone way too far. And that's why we're supposed to know exactly what we need to do right from the time that you're growing up. Because most of the time, the education should be taken out to children or people at an early young adults, just to make sure that they are aware of their posture. You remember long ago when you're going to school, when I went to school, there always this practice of balancing books on your chair.
Books on the head, yes.
Yeah, and kind of sitting and walking straight, so that you just get into the tone of, aligning yourself. basically.
Okay.
Sitting
Let's talk
upright.
about driving. Does driving also require a certain sitting position, especially for
Yeah.
those when you're doing
Yeah.
long distance? Like now, if you
Yeah.
drove to Mombasa, you'll
Yeah.
change your sitting position in to various ones.
Driving, you have to be aware of the chair that you're sitting on. Driving, if you're the driver, then of course you have to make sure that you've adjusted your leg level so that you're not completely straining at the legs or slouching over the wheel, so that you're completely in a good posture when you're driving. And most cars have this ergonomically friendly chairs that you can actually raise up, bring forward, do stuff. So cars have become smarter, and and it's easy for you to adjust yourself according to your driving. But apart from the the chair itself, I think what is most important is the suspensions of the car.
Okay.
If you have poor suspensions in the car, of course the little bumps and will be impacting. The trauma will be right onto your spine.
And I'm sure over a longer period of time, then you'll feel the effects.
Over a longer period of time, you feel the effects.
Okay. All right. For those of you at home, joining me in the studio today is Dr. Margaret Stower, and we're talking about your back, sitting postures, and generally sorting out back pains. In case you have issues with your back and you'd like to ask any questions, the phone lines are now open. You can give us a call. You can also tweet, and the Twitter handle is at Michael G. Gitonga, and we'll see whether we can float the questions to her. And those I'm sure she can handle, she will handle, just to see whether you can be a little bit more comfortable. Let's talk about sleeping positions, because that's another part we spend a long time. I mean, ideally, I think we're supposed to sleep 8 hours.
Yes, ideally 8
And
hours.
I was looking at some statistics, and it looks like quarter of our life is actually spent sleeping. But anyway, coming back to the subject, what are the correct sleeping positions, and also mattresses?
And also mattresses. Well, let's start off with the correct sleeping position. Most of the time, we advise you to sleep on your side, either the right or the left side. And even if you're sleeping on your back, make sure there's a pillow underneath your knees so that you take the strain off your low back. If you're sleeping on the side, the mattress should conform to your curvature, because people are different. You can't say that your curve should be this way and that other curve should be that way. But the mattress should be able to have a little give so that you can actually rest your body appropriately. And then it's very prudent to have a pillow in between your legs when you're sleeping on your side to get the pressure off the spine. Yeah.
Okay.
And always use a small pillow so that your neck is not strained with a very huge pillow.
I've seen, especially in hotels, they have quite a number of pillows. And somebody was even telling me the other day, there's actually, I don't want to call it a menu, but there's like a chart that tells you which pillow does what.
Yes.
What are the ideal pillows to use? Because you've got the very soft ones, you've got the hard ones, you've got some that are very thick. What's the best pillow to use health-wise?
Health-wise, it's a pillow that would be able to give in to your curvature on the neck. Make sure that if you're and follow your contours of your neck area. Ideally, when you're sleeping on your side, your head should be slightly higher than your shoulders, so that you're not completely slouching your ear into your neck area. So the pillow should be a little bit raised while you're on your side, and when you're on the back, then the pillow should be kind of flat.
Okay. Orthopedic mattresses, which I remember, I think, experiencing one, and I thought, man, it's like sleeping on a floor. Really hard. What's your take on orthopedic mattresses? Because I think they're hard. I'm not sure if they follow the...
Orthopedic mattresses have been overrated. You should have a mattress that can actually give a little weight to your spine, because people have different weights. So if you say you're going to sleep on an orthopedic mattress and you're heavy, then of course you'll find that a little bit too uncomfortable for you. You should have a mattress that can actually give way, kind of contour to your spine. Most of the time, I always advise clients to look into a mattress and try it out. When you're going to buy a mattress, lie on it for a few minutes and see how you feel, or an hour or so, just to see how it feels. It should have some give on it. It shouldn't be completely hard, because that may not make you relaxed while you're sleeping.
Okay. There's a question here via Twitter from Nico Kihara. Is there a specific standing posture? I work for 13 hours, standing full time. I think we normally address those who are seated, and you say take a walk. Now, what about somebody who's standing for 13 hours?
Yeah, 13 hours standing is going to be a long time. It's also a strain to your back muscles. The body is designed to move. Really, that's why we have those arms projecting out of our spine and those legs projecting out of our spine. So standing is going to be a long time. I would advise him to take a break a little bit. Don't go completely 13 hours onto standing, because usually your muscles will tense up and they'll get into contraction and into spasms. And then you'll feel pain. So break it up a little bit. Yeah.
Okay.
Or if he has to stand for a long time, take a stool and place one leg on it. That will shift your body weight a little bit that way, so that you're not completely strained out. Yeah.
When you're
and
standing
make
on both.
sure your work level is also not straining your back. Yeah. So
That's something
prolonged standing.
also interesting. When you're seated, what's the correct height for your hands to be, especially for those who spend their time, typing most of the day?
You should raise your desk level such that your elbows are at 90 degrees. Your forearm is at 90 degrees at the elbows.
Okay.
So you're comfortable this way, not up that way, or not too low up there, so that you're completely just 90 degrees within the framework of the body.
Or lower your seat to...
Or lower the sheets lower.
To get that. All right, what about lifting? Is there a specific or good lifting posture? Especially for those who lift heavy objects. I know that there are some who actually lift, and at the point of lifting, you twist your back. Is there a correct posture for lifting?
Lifting, always make sure that you don't lift things that are too heavy for you, depending on your frame. How do you determine that? That's good. That's good, because recently I think there was a format of people not lifting gunny bags that are weighing more than 90 kilos, so they went down to 60. And that was just a sense of really looking at the weight that they should be lifting. And then again, you have those people who probably work, let me take this market downtown.
Marikiti there.
Marikiti there, yeah. Carrying potatoes or bags of potatoes or whatever they're carrying on. But because their body is toned to it, the muscles have been developed in such a way that they can lift that particular weight. They know that obviously they will not strain. But you not having that kind of training or tone into that particular side, you need to be sensible. Do not lift anything that is too heavy for you. And if you have to lift, bend so that you're using your leg muscles to help with the load. So you're bending, you're bending your knees so that you're squatting and lifting it up, as opposed to going right down, because that projects a lot of load onto your back.
Okay, now going back to those at Marikiti, or even similarly, those who possibly train in the gym and lift heavy weights.
Yes.
Isn't that bound to affect you later in life? Because you might be toned now, but what damage are you potentially doing to your back in the future?
Yeah. I have seen, for example, that people who lift weights in the gym actually have a little big lumbar, a belt around their waist, and that kind of braces that spine such that they can take the tone of the weight. And just proper weight lifting mechanism is what that tends to help them with the lifting.
Okay.
So they have the use of the big belt here. But likewise, they need to be careful about how much weight they're lifting. And they gradually have to step up the weight load, such that if you're starting off weight training, you shouldn't go from 5 kilos to about 60. You have to gradually build increase into it as your muscles get toned up and they're able to take more load than usual.
Again, because of our lifestyles today, we have more people going to the gyms, and you'll find, unfortunately, I don't know how many of the gym instructors are trained and qualified to actually, help in a fitness regime. Are there some exercises that you'd be a little bit wary about to do, because potentially they could strain your back, apart from weights? At the gym.
Apart from weight.
Because you've already talked about the weight. You've mentioned that you need to gradually increase. But you've got all these exercises that you do. You might be on your back and you lift your legs. There are others who make you do different things, in the gym. But yet I'm not sure how qualified the instructor is, especially when it comes to your back.
Yes. One of the things that is very crucial is if you have a back problem, you should be able to inform your instructor that, I'm just recovering from back pain, and so he needs to gauge his regime according to you as a person.
Right.
So most instructors are very well trained in aspects of musculoskeletal disorders, and also on how they should be able to train certain individuals. Because half the time when you come into the gym to train, you're supposed to undergo a medical evaluation to know if you have any conditions that might be indicated, might affect you during the time that you're training.
Okay, let's talk about pregnant mothers.
Right.
Because, of course, for them, posture may have to change, given that they have this weight ahead of them. Maybe as the baby develops, what should they be wary about, or what are some of the things you'd advise them to take care of their backs?
To take care of their backs, it's very important that they start onto their exercises. They have Lamaze classes that they start immediately once they're pregnant to tone up that muscle, those abdominal muscles that may be holding the weight, so that even as you advance in pregnancy, your body is able to take that load and be able to manage it. But it's also important for them to be able to wear low heels so that they're not tilting their pelvis a little bit higher because of the anterior load of the baby. So they need to be sensible about their footwear. They need to also be able to tone up their muscles and exercise. Exercise is not contraindicated for pregnant mothers. They need to exercise right through to make sure that they're toning up their ligaments and their muscles in. Because during pregnancy, there's increased hormones and they may very lax, so the muscles are kind of a little bit too lax and too weak, so to speak. So it's important for them to undergo some exercises.
Okay. Does their sleeping position change when you become pregnant? But you need to sleep differently.
It's very important for them.
Because again,
to
you're looking at the comfort. I mean, you may want to sleep the way you want, but sometimes the stomach tells you, nah, you're going to sleep this way. Are there recommended ways that they should sleep?
Side sleeping is the most
So it still
comfortable.
applies, eh?
It still applies to pregnancy.
Okay.
Place pillows in between your knees so that you don't have too much strain on your low back.
Okay.
Yeah.
After childbirth? After
childbirth, very important to tone up those muscles, get them back into structure so that you don't strain your back. As we said, low back pain is very, very common in pregnancy. So it's important for them to keep on exercising after childbirth.
How soon after childbirth? Because I've also had certain areas where they're told to rest it until a certain while, until the back comes back to its normal form.
Right.
So should they exercise immediately after? Should there be a period of waiting?
Right. Even at rest, there are certain exercises that they can do that doesn't need to be weight bearing. So they're actually what we call kinetic exercises, which means they're just, kind of contracting within their own muscles and being able to tone up. So immediately after birth, you can start on to some exercises of some sort.
Okay. Lucy Jerry via Twitter is asking, I have experienced very sharp lower back pains. I am 4 months pregnant. Should I be worried and should I seek help?
Yes, she should.
4 months pregnant.
She should seek help. It either means that there's something that she's doing that is straining the back a lot more. Apart from the baby, she's into, did she say 4 weeks?
4 months.
4 months.
4 months,
okay.
Yes.
She's into 4 months pregnancy, so she's actually straining a lot on the back.
Okay.
So she should be able to seek help. And there are certain things that would actually help with her.
We'll come to the solutions and how a chiropractor actually works towards achieving a healthy back. But let's first of all talk about a slipped disc, because again, that's something else that is still within this structure. What is a slipped disc and how does it occur and how does one solve it? Let's start with what is a slipped disc.
Right. Within the framework of the vertebra form of the skeleton, the vertebral body, we have discs in between the vertebrae, those bones, and the disc actually is supposed to absorb the shock of our body, any little trauma, any little shock. It's a shock absorber, like you have shock absorbers in your vehicles and things like that. So when a disc slips, it's because there's been too much compression on it. And what normally happens is there's a little tear in that little ligaments in between the covering of the disc area and then the nucleus, which is a soft gel-like material that's contained within the disc, actually protrudes out and compresses on the nerves right through. So if you look at that little red area here, that's what's happening right there. So the nucleus, which is contained within the disc, protrudes out, and slips out and presses onto the nerve area, and that's when you
this yellow thing is a nerve. I'm not sure they can see it at home, but yeah, okay, that's a nerve.
Yeah, that kind of registers pain in the body. So nature has it such that we have various discs in between our vertebral bodies. So you may have a protrude disc somewhere, but you may not have as much pain because the other discs are also supporting you.
Okay.
Yeah.
All right. Now let's go to some of the solutions. How does a chiropractor ensure that we get back our healthy back without administering medicine? We're in a regime and a time where we feel that unless I pop a pill, I may not be well. So how do you go about making sure that I have a healthy back?
Chiropractors are trained in the manipulative skills of manipulating your spine such that it's in alignment from one vertebra to the other. Right. When we started off, we talked about the correct posture and the correct curvatures on the spine. So chiropractors are trained by the use of their hands to manipulate that vertebra such that you do not have too much pressure on your disc levels and on your nerves as well, because it's the nerves that actually register the pain.
Okay.
So we normally use a hands approach modality where we manipulate the spine using our hands, and there are some special tables that can enhance that adjustment. We call it an adjustment, meaning that if something has been misaligned, then of course you're adjusting it back into normal position. It's just increasing mobility in a vertebra from one place to the other.
Okay. So is this purely by, is it almost twisting it or knocking it back into position?
It's a technique. It's not really a twist, so to speak, but it's a technique where you have to know the line of drive where you're going to apply that particular force and get it back into into position. And having said that, the position is not like it's completely out of whack. It just could be a little rotation from one place to the other, and you're actually getting it realigned.
Within chiropracticing, if I can call it that.
Chiropractic.
Chiropractic. Do you use acupuncture as well?
Acupuncture is a treatment that some chiropractors are trained to use, but you need to be well versed and trained into it. And it has its own role in relieving of pain.
In relieving of pain. Now, it almost feels, I mean, looking at it, I've never done acupuncture, but it almost looks like you're putting pain to relieve pain. You know, when you use pins and all that. Is it painful?
It is. I've not experienced it per se, but it is a very sharp pain according to what I know, and it's not uncomfortable for that particular period
It's not
of time.
uncomfortable?
No.
Okay. And now coming back to, there's some, what would I call them? There's some mats which not too long ago that were being sold and, you know, sort of given out to people that are supposed to detoxify and deal with your back. I don't know what your comments would be on that. They not conventional medicine, it's not medicine that you take, but there are particular mats that apparently if you sleep on, they do two things. One, they detoxify. Two, they help you align your back. Yes. Is that something you're familiar with?
It's something that I'm not very familiar with, but one of the things that people have to be aware of, that if someone is pushing a product across there, you need to make sure that it has been scientifically proven that it works, and also that the person who is treating you or aligning you to it should be able to be quite qualified in the fact or in what he's pushing forward on.
Okay, so that's not something that is under the chiropractic.
No, it's not something that is under the chiropractic regime. But
okay.
Yeah.
All right. There's also, apart from the slip disc, we also have this bone. I don't know what it's called.
The femur. And the pelvis.
Yes, the pelvis. When it disconnects, what causes that, and is it possible to have it through your practice, you know, put it aligned back, or does it have to be done through surgery?
Okay. Depending on what we're talking about, disconnection. But the thing is, the pelvis makes the foundation of our it's actually the base of your spine. Yeah, because the weight comes in and is transmitted right through and into the leg. So the pelvic has to be in balance, such that you don't have one pelvic bone that's a little bit higher than the other, causing strain in various areas. And chiropractors are trained to adjust the pelvic bone such that you can have a firm foundation. It's like your base when you're building a house, you want something firm on before you start projecting upwards. So you need to have a base that is firm and solid, so that when you look at the spine, you're actually well aligned through. And
let's talk about footwear, because I'm sure at some point it affects your back, and specifically ladies' footwear. You've got some very high heels. Nowadays you've got high heels and a huge block. What's your comments on footwear, and what's the correct footwear in regard to your back?
Yeah, footwear, ladies are very conscious of the way they look, and obviously the higher the heel, the more elegant they look. Yes, the more elegant they look. But it really places a lot of strain on your spine, because you can imagine if you're wearing about a 6-inch heel, you're tilting yourself forward just to keep your balance, and your pelvic is rotated backwards this way. Eventually the muscles that are attached from the pelvic bone to the back are under a lot of strain, and at the end of the day you may have a low-grade low back pain without realizing that it's just because of your heels. So we advise that even if you have to wear heels for meetings or something else, make sure you carry a lower pair that you can change out of, so that you're not completely in heels throughout the day. So always be wise about heels.
Are there times regarding, when it comes to heels, or is there an age group that it's okay to wear, then at a certain time you reduce? Or is it meant to be a no-no right from the beginning?
It depends on the individual, because you can wear heels right throughout your life. They just, as I said, you have to wear it for a shorter period of time, and then it depends on the person themselves. If you're able to carry yourself higher on heels and walk elegantly, so you don't want to wear heels and someone sees you and you're trying to struggling to keep your balance. You have to be comfortable in them and make sure they're not completely throwing your posture out of whack. Yeah, we always advise wedges. Wedges are good, but yeah, as you said, I know younger people are able to carry themselves easier in heels, just because maybe their weight is a little bit lower, so they are able to stimulate around on heels, rather than older people who might be a little bit more weight getting on with, may heavier and may not carry themselves.
All right, as we summarize, is there exercise that would help you strengthen your back?
Yes.
What exercise would that be?
The major exercise for strengthening the back is the core. The core muscles, abdominal muscles. Those are actually our mainstay of the back.
So what, like sit-ups?
Make sure, sit-ups, using little Swiss balls to tone up the muscles, planks, things that make sure that you're engaging your abdominal muscles, because these are the ones that actually support your back. Half the time, people come in with low back pain, but when you look at their core muscles, they're kind of a little bit saggy, and they're not able to engage the back. So you work with your core as much as you're working with your back. So it could be an extension exercise, it could be a flexion exercise, it could be just basically building up the muscles on the spine.
All right, thank you very much, Dr. Margaret Storr. Maybe finally, if somebody wanted to get more advice from you, because I'm sure we cannot cover that in the show, and there are some who possibly would need to give you more detail for you to help them out, how would one get in touch with you?
Okay, you could email us on info@pcc.co.ke, or you could get us on chiropractic, www.chiropractic.co.ke as well. Visit our website and you'll be able to find us on there.
All right, thank you very much, Dr. Margaret Storr. I'll just give you those details again. info@pcc@chiropractic.co.ke, or you can go to the website, and that's www.chiropractic.co.ke. Well, that's where we're going to wind it up today. And thank you so very much for keeping us company. Do have yourselves a great day. Thank you for staying with KTN. Remember to join us again tomorrow on Morning Express, where we'll be having the newsroom. And also tomorrow being a Wednesday, we deal with relationships on lifestyle. So find out what that will be all about. So from us here in the studio and the Morning Express crew, we wish you all a fantastic and a wonderful day. Do have a good day. God bless.